I'm Richard Conway reporting for Room Now from ACR 2024. Today I'm going to talk to you about an abstract presented in Sunday's poster session. This was by Mark Gibson and colleagues from King's College London. It's abstract number 989. So this was a Bayesian network meta-analysis. And I know a few people have already glazed over at that combination of words. But I'm going to try and keep it real simple for everyone, and we'll try not to get too bogged down in the details. But I think it's an important and provocative study that's being presented. So this was looking at malignancy, and it was looking at JAK inhibitors, TNF inhibitors, and patients on placebo, and trying to compare those different groups. It was across inflammatory diseases. So there was patients with rheumatoid arthritis, with psoriatic arthritis, with psoriasis, and with inflammatory bowel disease, and axial spondyloarthritis. They included 196 studies. So this is a large meta-analysis. They had over 120,000 patients and 130,000 patient years of exposure. There were 68,000 patient years of exposure to JAK inhibitors, 56,000 to TNF inhibitors, and 10,000 to placebo. During this, they saw just over 1,000 malignancies when they excluded non-melanoma skin cancer. So this is other malignancies. Now, it said it's a Bayesian network meta-analysis. So the figures they report as a log rate ratio, which is, we're not used to looking at that. It's confusing to us. So I'm not going to get too bogged down in it. If you want to go check out the poster, please do for those finer details. But I'll just stick to the bottom line of what they found, because I think it's very interesting. So they found that TNF inhibitors had a significantly lower risk of malignancy than JAK inhibitors. So we expect this given oral surveillance. So this kind of fits with our priors. But then it got really interesting. So TNF inhibitors compared to placebo have a significantly lower risk of malignancy. JAK inhibitors compared to placebo seem similar for any type of cancer. And JAK inhibitors seem to have a lower risk than placebo for hematological malignancies. So this is a very provocative study, I would say. It's kind of jiving with what some of us have been saying about oral surveillance, that maybe it's not that the JAKs are bad, it's that the TNFs are good at preventing malignancy. It's one meta-analysis. We can't place too much weight in it, but I think it's a very, very interesting one. So I'm Richard Conway. You can follow me on Twitter at RichardPA Remember to tune into Room Now for all the best coverage from ACR 2024.